Before local anesthesia, it's very important to marking the cornea at 0 and 180 degrees while the patient in upright sitting to avoid sacral torsion while the patient in supine position. As we can see, here is my case of the capsulaser assisted phacoemulsification with monofocal toric IOL. As we can see, the axis of placement of the IOL is 174 degrees and my incision at the 180 degrees. Here is the IOL calculation, and my lens is monofocal toric by the AST. I started as usual with the paracentesis, then 2.2 clear corneal incision. I fixed the eye with the MVR, then applying HPMC over the cornea, then injecting the capsule blue inside the AC. Wait for about 50 to 60 seconds, followed with wash out the capsule blue. As we can see now, beautiful homogeneous staining of the anterior capsule with a central triband landmark. It's very visible and it's very clear. Then firm backfill technique of the antechamber with dispersive OBD. Here is, you can see a well-centered laser circle with the central triband landmark, then applying the laser to achieve a beautiful, well-centered, well-sized, amazing capsulorhexis. It's 5.3 millimeter in diameter. Then removing the central disc of the capsulotomy using the capsulorhexis. Here is the hydrodissection. Look at the beautiful posterior fluid wave. Then gentle hydrodelineation and rotate the nucleus to be sure that your nucleus is free. Here is the phacoemulsification of this cataract. I prefer to use horizontal chop technique as usual. First chop this nucleus into halves, then chop and chop and chop into small pieces. After that, emulsify each piece alone, as we can see. Then moving to bimanual irrigation aspiration to clean up the cortex, as we can see, and also to polishing the anterior capsular rim. As we can see now, I have a beautiful capsulorhexis and everything is clean. And now the time for forming the capsular bag with the cohesive OVD to implant the monofocal toric IOL. Here is the viscoelastic. Now implanting the IOL. Here it's very important to adjust the marks on the IOL with the marks on the cornea. As we can see now, settling the IOL inside the capsular bag, and look at the dot marks on the IOL. It's opposite to the haptics. Then wash out the viscoelastic. While washing out the viscoelastic, also it's very important to wash the viscoelastic behind the IOL, which is very important in patients with toric IOL, and that could help in preventing any postoperatively rotation of the IOL if you clean the viscoelastic properly behind the IOL. And as we can see now, I am doing a good alignment between the marks on the IOL and the marks on the cornea. It's very beautiful and it's very clear. Look to the both sides. Here is the nasal side and here is the temporal side. It's very clear and correct alignment. Then doing the stromal hydration for the incision and corneal paracentesis. And thank you for watching.